There you go. You think the last part came out at all? You don't think it came out?
It looks like it says it's streaming live on Facebook now.
Now it says it, and it didn't say that for me before, so I'm not sure.
Yeah.
Are we? I think we're on now.
Yes, I think we're on now.
Good. So we're back. I wanted to restart what I had said before. I wanted to welcome everyone to our first live Facebook event. This is the first time we've had the experience to do this since I've been in the home and sort of Dr. Sijisi on top and Dr. Law on the bottom. We've been at home. I've been trying to be more upfront with patients and trying to be more communicating with all of you. You've gotten probably 4 or 5 newsletters over the last month since we closed around the middle of March, and I'm trying to let everybody know what we're doing and trying to be aware of the surroundings, things we're doing in the office in the future. And I just wanted to welcome everybody to our stream. Tonight we want to discuss about just how to take care of your eyes during being at home and sitting at the computer a lot. Again, I want to introduce Dr. Sijisi. She's on top. She's one of our associates, and Dr. Law, who's been in the practice for about 10 years. She's on the bottom. Dr. Sijisi is in Manhattan. I'm in Mahwah, New Jersey, and Dr. Law is in Long Island. So we wanted to kind of welcome everybody, get used to, and we wanted to express our concerns about all of you out there. We're assuming that most of you are probably working from home. Some of the people in the nursing and physician fields may be working in hospitals, and if that's the case, we thank you for all the work you're doing. But those of us that are working from home, it's a different world, and we're doing things a lot differently than we used to. And the main thing we wanted to go over is to let you know different things you can be doing for your eyes while you're sitting at home and sitting at the computer so long. We're also want to discuss on today's broadcast a little bit about the future of when we think we can reopen our practice. As I mentioned before, if some of you were on before, many of our colleagues across the tri-state area have been staying in their offices, just seeing emergencies. I would say probably very few of our colleagues are seeing any routine exams. That's pretty much been told to us by CDC and the state that we should only do emergency exams only and taking obviously proper protection. We have not done any live exams in the office. We've closed the office since the mid part of March, and we just feel with our staff having to commute from the suburbs, it's difficult for them to get in and deal with the danger of being in the subways and exposed to virus, getting to the office and being with patients. I think it seems like over the last couple of days, it seems like the governor of New York and New Jersey is considering reopening on a gradual basis in the middle of May. So we're kind of looking at that date for ourselves also. One of the things that we spoke about this morning, the 3 of us discussed, is how we can prepare the office for live patients to come to the office. And we've done some different things with the office. We've added counter displays, plexiglass. Like if you've gone to the supermarket in your neighborhood, they have plexiglass to protect you from the cashier. We're going to have that on our front desk. We're also going to have a plexiglass in front of the optician in the dispensary. Prior to this pandemic, we had actually planned a reconstruction of the dispensary. We're adding new displays, we're adding a whole new look. That has yet to be installed because the factory is closed, but hopefully by the time you guys come to the office for your next exam, you'll see new displays in the dispensary and a whole new look. We're also going to open up one of the walls from the waiting room so that people sitting in the waiting room can see into the dispensary and feel more comfortable just walking in, trying on frames. The things we also plan on doing when the office does reopen is we're going to take temperature of every patient before they come in. We have one of those temperature thermometers that doesn't touch your face, gives us an idea if you have a temperature. If you have a high temperature, we would of course then suggest that you don't come in for the exam. We'll also be requiring patients to fill out a history form before they come in to let us know if they've had any exposure to the virus, whether they've been sick lately or had a cold or a fever. And obviously those patients we advise not to come for the live exam and to go see their physician or stay at home. The other things we plan on doing is taking a little bit more time with patients. Normally we give about 25 minutes in the schedule for each exam. We plan on expanding that to about 45 minutes, depending upon the type of visit we'll be seeing you for. And we'll be cleaning all the surfaces after each patient leaves and making sure all the equipment has been disinfected. The other thing I think we'll expect to do is only have one patient in the waiting room at a time and one patient in the back being worked up by our assistant. And that leaves only probably just 2 patients in the office along with 3 staff members. So that gives us enough space not to be super close to our patients. We will require all patients coming in for exams to have a mask. We're hoping that most of you that do come in for exams will have the mask already because you probably shopped in supermarkets and in and around the area that required it. If you don't have one, we'll provide that for the visit. All the doctors and all the staff will be wearing masks also. In addition, we'll be requiring the patients walk in to wash their hands when they walk in. And we don't require that the patient have gloves, but we'll be wearing gloves to make sure that any surfaces we touch don't get transmitted to the patient. We obviously won't be shaking your hands. That's probably not going to happen anytime soon, just because of recommendations on how to transmit the virus. Most of the docs, myself included, do wear glasses. Dr. Locke wears glasses. I wear glasses. Not tonight, I'm not. Dr. Zagisi doesn't, but we don't really think that the transmission of the virus through the tear film is that big a risk. It hasn't really shown that the virus transmits through the tear film. But I think there's more evidence that the virus, if it is transmitted to the eyes, could cause an eye infection, but you can't really get the virus or get sick that way. At least that's what our understanding is. And any other precautions we have with regards to picking out eyeglasses, we'll have a way that all frames that are tried on get disinfected afterwards and get put in a soap bath of some type so that they get disinfected. They don't go back on the frame board until they've sat around for at least an hour dry. And we're hoping that that should kill the virus and that shouldn't allow any transmission of the virus that way. It'll be a little different in that patients will be putting frames on with a mask on, so it's going to look a little different. We do have actually a live virtual frame display that's available through our website that you'll be able to see, so you can actually try on frames at home before you come. It's a full frame gallery that's produced from one of the vendors that we work with and has all the frames that we carry, plus it even has a more extensive selection of frames that we don't carry on the board that you can try on. It actually mirrors your face with the frame, and if you can see exactly how it looks, you can actually favorite those frames so that before you come, we have a list of frames that you might like. So those frames we can pull aside for you and you can try them on live. Other things we'll be doing is probably with regards to credit card machines, we'll be wiping that off and sending you a receipt instead of handing you a printed receipt and things like that. I'd like to, Dr. Law, maybe the first to start and weigh in about her thoughts and what she's been doing during the pandemic. She has 3 children at home and she's been busy with them, and she can tell you about what she's been doing.
Sure. I've been taking care of 3 kids and a dog. And the happiest mammal here is the dog, because she's getting walks all the time and getting playtime outside with the kids. And we've been taking a lot of hikes. So we've explored a lot of different hikes out in Long Island. It's been really kind of fun while social distancing, bring the dog out and playing. So as much as we can when the weather's good. And aside from that, they're keeping my hands full with the remote learning at home, which is a challenge because I am learning a lot of new things about the circulatory system and the respiratory system and some other projects for the kids. So really cool science projects that I've been happy to be working with them on.
Great. Well, that sounds like you're keeping busy, and as we all are. And then we have Dr. Sigisi. She's living in Manhattan. Her husband's a dentist in the New York area, and she's been kind of hunkering down, and why don't you tell us what you've been up to?
Yeah, so it's just my husband and I here. We decided to ride this out in Manhattan. So we've been in our one-bedroom apartment, just the two of us, for about 4 weeks now. But everything's good. We're healthy. We've done a lot of puzzles. I've done a lot of reading, taking a lot of continuing education courses. So trying to keep the mind busy and active, and looking forward to getting back out in the real world.
Why don't you tell us a little bit about your husband's family? I guess there's been some of them are living in Italy, and you had some experiences you shared with us during our meetings.
Yeah, so my husband is originally from Italy. He moved here when he was young, but most of his family still lives over there, luckily in the South. So they were not, most of them don't live where the huge infections were up near Milan, but they've been very affected by all the closures, and they've been inside with their young children. But the spirit there is good, like the spirit here, everyone's very positive. They send videos of them, just like you see online. They are actually going out in their balconies, singing to each other, playing music for each other. So it's been difficult, but you can see the culture and the family culture there coming through.
That's great.
Yeah. I think we're all adapting in different ways. None of us ever lived to think that something like this would happen. We've read, science fiction saw science fiction movies, read science fiction books, and never anything that was discussed in those we ever thought would happen. And this is going to be even beyond what they've thought could happen. So we're learning as we're doing, but in our field, nothing has really changed much. Contact lenses will still be available. I know in the beginning of the pandemic, a lot of our patients were ordering a lot of contacts through our staff and online, and thinking maybe contacts wouldn't be available, but none of the factories and manufacturer contacts have shut down. Most of them are based in the United States, but most of the big companies, CooperVision, Johnson & Johnson, and Alcon, have factories in Europe, and that has not really been affected by any back orders, any problems with this distribution of contacts or solutions. I think the biggest challenge for us is going forward is having all the disinfecting chemicals, be able to get that for the office and keep everything clean. But it seems that with China opening a lot of the masks and different items that we'll need to run our practice will become more readily available. I think a lot of us, we're talking what kind of testing is going to be available for people. I kind of envision that maybe over the next month or two that certainly primary doctors will have these tests. They'll be doing it in their office. Hospitals and clinics will have these tests, and they'll probably be testing antibodies to see those patients that have had it and whether they are less likely to give the virus to somebody else. And that will also give the public health officials some indication where there might be some hotspots still, or where there's still some a higher trace of the virus that they would maybe want to modify how much has been opened in those communities, so they can probably target people better. I don't know if those testings will be available in a optometrist, dentist, or chiropractor type of practice, but certainly primary doctors will have access to those tests, I would say, probably very soon. One thing I wanted to discuss a little bit about is, how the eyes are affected by the coronavirus. I put together a little article that I got, and I put together. I'd be happy to provide that to patients if they're interested. But one thing I think that's been talked about is, do glasses provide some type of protection against the virus? And I think we feel that it does in some way. I mean, as I said before, I don't think the virus can be transmitted through the eyes. You're not going to get sick by getting someone sneezing in your eyes. It's generally a breathing situation. That's why covering your mouth and nose is important, because if you do breathe the virus and you're susceptible, you can get very sick, as you've heard. But as far as just protecting the eyes against the virus, contact lens wearers, especially wearing some type of overglass on top of the contacts, is probably a good idea, certainly when you're outside or you might be close to people. We think that the virus could be transmitted in the eye and give you an eye infection. Again, it's not going to make you sick, but it could give you a pretty significant eye infection. In the virtual exams that I've done over the last month, we have had a number of people that have gotten eye irritation, eye infections. Unfortunately, we don't really know how they got it. It could be from staring at the computer a lot. Most of us are probably spending a lot more time on a screen than we did in the past, even though most of us use computers all day. But I think the glasses do provide some kind of help in preventing some of the respiratory droplets from getting in your eye. I think outside wraparound protection probably even better. One thing that people are concerned, you may be concerned, is how to disinfect your glasses. Obviously, we take them off, we go to a supermarket, you could be exposed, and there's been a lot of talk on the news that these kind of germs can live on surfaces for quite a while. And how do you disinfect your glasses? I think the best thing is to put them down on the surface. You want to kind of wash your hands first, and then you want to kind of clean off the glasses by rubbing them with some type of solution. You'd never want to clean your glasses dry, because that can just make the glasses more susceptible to scratching. Any kind of little fibers or dust that are on the lenses, if you do wipe them dry, will just cause more scratches. So you never ever want to really wash or clean your glasses dry, but you should put some type of cleaning solution, whether it's just regular water and some soap, or whether you want to use alcohol. All those things are safe to be used on the glasses. One thing you don't ever want to use is acetone. Acetone will get rid of some of the coatings that are used for glare, will probably cause the lenses to get all coated. So you never want to use acetone, but alcohol is perfectly fine. And just kind of lukewarm water is probably fine. Rubbing the lenses, rubbing around the eyepieces, around your nose for about 20 seconds, and then kind of wash them off or rinse them off with water, and just use like a dry cloth, even a good paper towel to dry them. As far as contacts go, we know the contact covers about 30 to 40% of the ocular surface. So wearing them certainly provides some protection against anything getting in your eye. As far as foreign bodies, we always know that wearing contact lenses provides some relief for that. And even those of us, myself included, have started to cook a little bit more. I've never really been a person that cooks at home, but since I've been home a lot, I've learned to do some things I never did before. But one thing I learned even when I was a teenager wearing contacts is when you wear contacts and you cut onions, your eyes don't tear. So that's one of the advantages of contacts, is you won't cry when you cut your onions. When it comes to other things, you just want to, if you are a contact wearer, you want to obviously try to disinfect them with the regular disinfecting solution. If you're wearing a 1 week, 2 week, or 1 month lens, if you're wearing a daily lens and it's not a concern, you just take them out with clean hands and throw them away. But wearing them outside, wearing a protective glass on top of the contacts is a good idea. A lot of our patients have asked over the last few years, do the blue blockers, would getting a pair of blue blockers wearing with contacts, or even getting blue blocker glasses, help with eye strain? I know I've told my patients that they have some type of benefit. I think some of it's anecdotal, but there's been some research that the blue light from the computer does cause eye strain, can contribute to headaches and loss of sleep. So we do recommend putting the blue blocker on glasses. I'm not so much as telling patients that wear contacts that don't need glasses on top, if they're younger, to go out and buy a pair of blue blockers. But if you're getting a pair of eyeglasses that you're going to be wearing at home for a computer, we do recommend having the blue blocker added to the lenses. Dr. Lowe, what do you think about that? I know your patients probably ask you the same thing.
Yeah, they ask me the same thing. I mean, I do tell them that there are several different ways to block out light, either on their screen. So some patients are already savvy and they have certain software programs that will darken the screen, sort of something like your nighttime settings on the phones. So if they have that kind of software installed into their computer monitors, that'd be great. They could use that. I always tell them the choice is up to them, because there's different ways that you can block out blue light through your screens. One way is to do it through the screen itself, or if they are wearing like a set of eyeglasses that have blue blocking light filters on there. I usually tell them it doesn't matter if you do one or the other. If you do both, does it make it extra protection? I don't ever really subscribe to that. I usually tell them whatever you decide to do and whatever is more comfortable for you. If you feel like, the glasses are great, or the soft, whatever choice they have. So as long as they're doing something, I think is the main point for at least my patients. And I usually go over them if, some patients who don't have a nighttime setting or unaware of the nighttime settings on their phones or screens, I usually kind of show them in the office where you can set that up. But for the most part, I do get that question asked a lot, and that's usually my answer. I don't know if that differs for the other doctors on here, but I usually tell them it's if you do all of it together, it's not extra.
Yeah, I agree. What about now that you have young kids at home? How do you take care of their needs, and then
glasses.
do you limit their time? Do you limit their time on the computer, or limit time on the iPad, or?
I am guilty as charged in terms of being a real parent and understand that sometimes limiting time can cause other things like
Right.
that you don't need to worry about. But I do try to have them when they're on their screen times. Allie's wearing glasses, so she has some sort of protection on there. And we kind of break up the routine. They don't, when they are remote learning, they're on there for most of the morning, but sometimes they can take breaks, and get up and grab some water, or grab a snack in between, and really kind of break it up so that they're not constantly on the screen throughout the entire day. The other thing is trying to get them outside if it's possible. I know, depending on where you are, but just going outside in the sun, getting some vitamin D outside is really important for them. Getting that sunlight also prevents myopia progression. So going outside for an hour a day, which, now they have a little bit more of the luxury to do, versus when they were in school, they only have that 20 minutes of recess outside. I try to get them outside as much as I can, just to kind of get that, get some of their energy out, which has been helpful, but it depends on the weather, like today was pretty bad, but all of a sudden right now it's sunny out here. So maybe they'll go out right now.
Yeah. I think that's good advice. I think that's really good advice. Dr. CJC, what are your views on blue light and just normal hygienic recommendations for the eyes?
I agree mostly with everything that's been said so far. I think that not all the research is there for the blue blockers, but like you said, anecdotally, I think it makes sense, the thought process behind it. I like telling patients to dim the screen and use the nighttime filters as well. The only thing really to add about glasses versus contacts is, in theory, the glasses could sort of provide a barrier, not necessarily from the respiratory droplets, but from you actually physically touching your eyes yourself.
That's a good point.
Really, your hands can be
Excellent point.
but as long as you wash your hands before you touch your face or your eyes or your mouth, then you should be fine. So the glasses can sort of prevent you from being able to actually physically touch your eyes.
Yeah, I think that's a good piece of advice. I think it also goes along with wearing a mask, is that if you wear your mask, you're not as likely to touch your nose or touch your mouth, and therefore if you do touch by accident, you have that barrier.
Exactly.
And that's why I don't think many people recommend that get hung up on N95 masks versus the standard surgical masks. I think that probably any kind of barrier is fine, as long as you're using it.
Right, using them properly. Yeah, exactly.
Right. What about Krista, Dr. Sajisi, the recommendations of many hours sitting at screens? I know both of us have always recommended that 20/20 rule of looking away. What do you use on that, and just hydration and using dry eye? A lot of our patients come into our practice, since we have a dry eye practice, about a lot of symptoms from dry eyes. What kind of things can you add to that?
Yeah, if I've given you an eye exam and you're a computer user, you've definitely heard me give you the 20-20-20 rule, which is every 20 minutes of near work, you should look 20 feet away for 20 seconds. I'm a big believer in that. The eyes need a break. We blink about half as much when we use a computer screen or really any sort of electronic device. Staying hydrated. If you're dehydrated, your eyes are dehydrated. Artificial tears as needed. I do prefer the preservative-free ones whenever possible, but just lubrication and taking breaks.
Yeah, it sounds like good advice. I think Most of the patients I've spoken to over the last 3 or 4 weeks indicate they feel like their eyes are much drier now than they were before they were uh, kept at home, and I think that's probably the same with most of us, is that we are using them much more than we ever did before. Uh, I want to see if this poll question works. I'm not even sure this is going to work, but I set some poll questions on Facebook. I want to see if it comes up. So here's the first one. Not that even shows up, but we want to kind of get a sense of people out there. Are you working from home? Whether yes or no. And if you see that question now, if you can answer it, I'm not sure it's going to show up. But this is our, as I said, first foray into this, so I'm not sure this is going to work the way I want. And we kind of want to get a sense. We're going to send out some type of newsletter the next couple of days, trying to get some insight from our patients that might be coming in for visits when we do reopen, what their comfort level is for coming into a live event, live exam. Do they feel comfortable coming? Are they living in the city? A lot of our patients, especially in the building where our office is, many of them, I've been there 1 or 2 times since we closed, and it seems like the building is somewhat desolate. So I'm assuming that most people may have moved out of the building and are living with relatives or parents in the area. How many of them are actually going to come back to their apartments within the next month and work directly in their offices? Because I think a lot of it remains to be seen if those offices will reopen at about the time we reopen. In that case, I think a lot of offices will probably require their staff to come in and work live. And we want to get a level of comfort that patients will have being in the office, considering we're taking all the precautions we possibly can to make things safe for our staff and also makes things safe for our patients. And as we've done in the past, we're going to take any precautions we need to, and we're going to make sure that we keep things safe for us and for our patients. And I think a lot of our patients probably welcome coming in. They're probably getting tired of being in their home, and they may have eye exams that haven't been done. We have done some virtual visits and we'll continue to until we reopen. But a virtual visit doesn't really enable us to look inside the eye. We can't look at the interior of the eye, the retina we can't see. We can't use the Optometry that we use in the office. We can't even use the microscope that we examine your eyes with. So those things are necessary as part of an eye exam. Obviously, even doing just tonometry to check your eye pressure is important. So I think a lot of our patients obviously will want to come in for those things when they feel it's safe and they're able to be in the city to come live for an exam. So I think our initial thought is we're going to open on a soft open. We'll probably be seeing maybe half as many patients as we normally see in a day and spending more time. And I think that'll make it a safe environment for the doctors, the staff, and also the patients. From here on, I don't have any specific things I wanted to tell anyone. I think this was a good initial attempt to get in touch with all of our patients. We'd love to hear from you. Some of the newsletters we send, we'd love to hear from you and how you're doing. Any questions you have, you can email us back. If you want to have that sheet that I went over regarding how to take care of your eyes, we'll be happy to forward that to you. And we do have a lot of our patients that have dry eyes, so hopefully some of the advice that we just suggested will allow you to take care of your eyes better. Those that were treated for dry eyes, very important to still use the hot compresses, the lid hygiene, and the vitamins and the artificial tears, because those things will keep your eyes from getting infected if you wear contacts or getting irritated from staring at the screen. And many of us that use computers all day, as we all do, I suffer from dry eyes myself pretty severely, and I haven't worn my contacts much over the last 9 months. But if you use the hot compresses consistently, you use the drops during the day, you use the 20/20 exercise, I think it'll go a long way to making your eyes more comfortable and making your contacts more comfortable. For those patients that wear monthly lenses or even 2-week lenses, we do find a lot of our patients do much better with the daily lenses, daily replacements, and we are starting to fit them more. And they're becoming much more available in a wider range of prescriptions than ever before. So when you do come in, we'll talk to you about it and ask you if you're interested. And if you are, we can get samples before you decide to purchase any. I think I'd like to close this today and just wish our best to all of our patients and hopefully your family and your friends and spouses and partners are doing fine, and hopefully that you're being safe when you do get outside your apartment, your house, and being safe amongst your friends. Zoom, like we're using tonight, has become a big item in how to communicate with everybody. Zoom parties, Zoom cocktail hours, Zoom weddings. We've all had those, and there's going to be a new way to do things until the society gets reopened fully. And any thoughts, Dr. Laura, Dr. Sajis, you have for our patients?
Same thoughts. I mean, everyone be safe, be well, you know, keep our heads up and keep our head in the game. We also got to hunker down a little bit longer. Hopefully we'll all get back to some sort of normalcy. And when we all do, I will be happy to see you. So I'm excited to kind of go back to normal as well, but we just got to do it safely and we're doing our best. So, you know, looking forward to seeing everyone.
Dr. Sajis, same for you, or you have any comments or?
Same sentiments. Just also thank you to you for organizing this. It's nice to see both of you and to communicate with our patients in whatever little way possible. And just looking forward to getting back in the office.
Great. Yeah, I think the other thing I'd like to discuss is, you know, try to stay positive, try to not, you know, we're all going to listen to news once a day or read the Times or whatever paper we read, but don't get overly obsessed with the news. You'll hear it some way, somehow, and try to, you know, watch TV and funny things and things that you like to watch that make you laugh, and try to be upbeat and try not to get overly anxious about the future. None of us know exactly what's going to happen, but I think if we do the things we've done as New Yorkers in the last month, we've really have flattened that curve. So I think if we can bring the curve further down, we'll all be safe and we can wait it out until a vaccine comes available so that we can be fully protected from this. Otherwise, I'd like to say adieu and say goodbye, and we look forward to doing one of these again before we reopen, and just keep in track with your email and the different announcements we have for the office. And hope everybody has a good night and stay healthy. Bye.
Thank you.
Bye.